I have the pleasure and honor today to have with us Professor Ho Nam Leong. He's a well-recognized infectious diseases physician practicing at Mount Elizabeth Novena Hospital in Singapore. He has been a fellow at the Royal Free and University College Medical School in London and also at Columbia University in New York. Besides his accomplished research activities, Dr. Leong is frequently sought for his opinion on infectious diseases such as COVID-19, and he is often interviewed live on TV, radio, and quoted often in newspapers and publications. Welcome, Professor Ho Nam Leong, and good evening to Singapore.
Good evening. I think it's good afternoon your side. Professor Joe, it's always a pleasure to speak to you.
Likewise, and we have known each other for, I guess, about 2 decades, so it is meeting back old friends. And I'm really honored that I have you today because you really know how to practice, how to help patients with dengue, right? We have a real expert on the ground in Singapore in a hospital, consultant infectious disease physician. He knows everything about dengue. So let me start, Ho Nam. How is dengue virus transmitted to humans?
So dengue virus is really endemic in Singapore, it's endemic in Southeast Asia, it's transmitted by the bite of a mosquito. Specifically, it's actually the Aedes mosquito. And if you realize there are 2 kinds of Aedes mosquito, Aedes aegypti is one of them. The Aedes aegypti is the primary one that's transmitted within the Singapore and within the urban region. Now, the point to note that it's actually it's a day biter. So in the day when I go out to work, it will come and bite me. And it loves the urban city, and Singapore is really, truly an urban city. You look at used cups from your coffee mugs to your used tires in the rural areas, and these are the places which will accumulate water. You see the £1 coin, the British £1 coin, that's the amount of water they need to actually for the mosquito to grow. And mind you, they like it clean. They're a little fussy, clean water, and it'll be great. And you realize in Singapore, you have sunny weather, you have the rain, and this provides great opportunities for the mosquito to grow and thereafter continue transmitting Aedes. Transmitting dengue.
Dengue, yeah. So now this is the transmitter. And what about the virus? I know this is a flavivirus, and there are several types of that. Maybe we can tell us a little bit about the virus.
The virus, they actually just, we call it, in the dengue family, there are actually 4 strains of them. There's 1, 2, 3, and 4. But you probably realize that we have a couple more viruses from the yellow fevers to the Zika virus. They are quite similar, but they are yet very different viruses. So for this talk, we're going to focus on the 4 dengue viruses, 1, 2, 3, 4. They are sufficiently similar such that they may trigger similar responses, but they are sufficiently dissimilar that each one can be a different episode of infection. Now, the problem is that after the first infection, the second infection makes it worse for the individual, and this causes death. Death in many, many people, especially the elderly. The third and fourth are theoretically better cases of dengue. So the first is bad, the second is doubly bad, the third is a bit better, the fourth is better. You see, the virus triggers the immune system, but the immune system, after the first hit, uses the first hit experience to try to deal with the second infection. But they end up messing up the infection, creating a propensity for worse infection. But when you end up with the third and fourth infection, the body kind of recognizes it a little bit better, and you could end up with better immune response. So at the end of the day, 4 strains, but the abnormal human response, how we deal with it, that created this dreaded dengue hemorrhagic fever or the worst dengue shock syndrome.
So if I understand this right, the dengue virus triggers an immune response. And then at some point with a second infection, the immune response enhances inflammation. It triggers a more severe response, and that would not be necessary, right? If the virus would be killed, that's it. But the virus really triggers, or the immune system triggers more more protection than needed, more inflammation than needed.
Spot on. So the reason as to why this happens, the actual mechanisms as to why it still happens, is still elusive. We think of the antibodies enhancing the infection, and this was proposed by Scott Halstead at least 20 to 30 years ago. But it is a very simple, easy way to understand it. It doesn't explain it, but understands it. Put very simply, the first infection creates almost like a Trojan horse effect. So when the second infection comes in, the virus enters and causes troubles at a much accelerated response, very much like a Trojan horse effect, and hence you end up with worse problems. But the good news is, of the 4 strains, you may have, let's say you had dengue 2 at the word go, dengue 3 at the word next one, dengue 4. If once you have had dengue 2 ever, you will be protected against dengue 2 for life. But you will then get the next one, which is dengue 3, that's worse. But if you get dengue 3 before and you're exposed to dengue 3 again, you will be fine.
So that's a bit complicated. What is in reality, do you see patients? I mean, you do see patients with dengue hemorrhagic fever, right? Severely sick patients with dengue. But if for me as a traveler to Singapore, I think I never had dengue coming being in Singapore for a couple of weeks. What is the likelihood? You have any incidence rates or any numbers on cases?
Actually, the statisticians have looked at it and remarked to actually get dengue in Singapore is a statistical anomaly. The chance is really, really quite low. We're talking about less than 1 in 1,000 or even 1 in 10,000. You see, Singapore has a very tough view and control of the mosquitoes. And because of that, the chance of getting dengue is really, really slim. To put things in perspective, at the age of 9 years old, less than 9% of the kids would ever have had dengue before. That's really a low figure. They can't even quantify it because it's too low. Statistically, you can't. But if you go down to Indonesia, Malaysia, or Thailand, the numbers could go up between 30 to 50%. But if you go down to Philippines, 90% of the children less than 9 years old would have been exposed to dengue virus ever. So coming to Singapore, getting dengue virus, it is a statistical anomaly. But yes, some travelers still get it. In the midst of it all, in the excitement of it all, you still get bitten. And chances are it is a day biter and something happened the day. You might also notice that these things happen not just once, not just to one individual, but the whole family. The trick is the dengue mosquito or the Aedes mosquito is a buffet mosquito. It doesn't stop after one bite. It goes on for about 7 to 8 bites before it stops. It just loves to sample many different bloods. And after the full meal with the 8th bite, they will go and lay their eggs.
Yeah. Sounds like a Chinese mosquito, right? If you go to a Chinese dinner, you order several dishes, never one, only one, right? Very nice. Yeah. Now, there are outbreaks. I mean, I've been to Singapore, and I guess since this is a day biter, during the days I were in my meetings, and the only thing I did ever is go to the evening zoo, to the night zoo, right? So this is safe, right? I have a safe behavior on that. Yeah. Very good. Now, I understand also that the Singaporean public health authorities really are very much after taking care of waters around, right? On your balconies, on your property, you have to make sure that there is not any assemblies of water or little seas or whatever. But the question is mosquito control, besides having no water sources for the mosquito to breed. What else is possible to control, or what do you do to prevent outbreaks?
From the WHO point of view, what we really like to do is to get rid of any breeding grounds for the mosquito, clear off all waters. But you realize it's really quite difficult in a tropical country where it rains periodically. Rains, immediately you have a puddle of clean water, and immediately the mosquito can grow. but it takes a while for it to grow. So you're encouraged to clear all the water there is every week. Look under the basins and places which can hold water. So water, getting rid of mosquitoes is one. The government takes a very strong view. They will go into your house to search for places where there's breathing. And if it's padlocked and you don't answer, and repeatedly so, they will break the locks and go into the house and make sure there's no mosquito breeding sites. And if you get caught with mosquitoes in your premises, not only is there a hefty fine, but a possible jail term as well. Let's be serious, because people are dying from dengue fever. It kills people. So the second thing which WHO strongly endorses is actually the use of Wolbachia. Wolbachia is a bacteria that grows inside the male's and the female's mosquito. But the unusual thing about it is, if a Wolbachia male present mates with a Wolbachia absent female mosquito, the progeny that comes back, they are sterile. They don't form viable mosquitoes thereafter. If you have a Wolbachia male, you must have a Wolbachia female mosquito for you to have progeny. So what Singapore has done is to release lots of Wolbachia-laden male mosquitoes all over. So they'll be competing with the Wolbachia negative male mosquitoes to try to outbreed and in turn cut down the transmission. So we actually have had quite good results with the Aedes mosquito population coming down by 30 to 50%. This has been done in other countries, with other countries reporting 80 to 90%. Now, to make things really simple about Wolbachia mosquitoes, think of them as the eunuch mosquitoes. Okay, they are there, but they can't fertilize the females. With the eunuch mosquitoes, you will then end up with decoys. The female mosquito will lay the eggs, but they will not be viable.
Wonderful. And look, having visited Singapore on a regular basis over the last 20 years, I never worried too much about dengue, although some of my friends living there, they had dengue fever, not dengue hemorrhagic fever, but dengue fever. Outside Singapore, I mean, going to the Philippines, Malaysia, wherever close by, the situation is a little bit different. They are large countries, and it would be very difficult to control the vector. It is almost impossible in a country like Malaysia or the Philippines, right? How can you check every little water source, right? It's not possible.
1 pound coin of water, that's all. Clear water, and with the rain that comes with the monsoon, you have it all over.
Yeah. So how do local epidemics outside Singapore affect the local economy? Are there is there something you can say about the damage that is done? I mean, there are many fields you can think about how such an outbreak would affect a community.
I'm going to talk a little bit about the illness first. It tends to strike many of the adults. In Singapore, it's more of an adult disease because they'll be going out and where they work, they'll pick it up. It strikes them with their economic prime, when they're making lots of money and they're generating and helping the economy. So that's a big burden. Number three, those people who have had dengue say it's one of the worst things in their entire life. The Australians and Americans will tell me, I feel like I've been hit by a truck, and they can't get out of bed at all. So number four, not only are you sick during the period, which is about 7 to 8 days, you drag on for another 7 days where you feel persistently fatigued. So the time away from work is really costly. You have a good question. I don't have the exact figures as to what's the dent on the economy, but it certainly is. And another thing that is quite remarkable is in Singapore, we are rather short of hospital beds. I mean, the hospital bed ratio is not something I'm proud of, but we are short of it. And when you are really sick, you may end up occupying unnecessary hospital beds, depriving someone who needs the hospital bed for a heart attack or stroke whatsoever. So another burden on the healthcare system of Singapore. So we'd rather have less of the mosquitoes and more of free beds.
Yeah, prevention is better than treatment, as always, right? And
Yes.
we come to prevention in a minute, but maybe I ask you, what is the relationship between dengue and other infections such as malaria, Zika, or any other flaviviruses?
Great question. You see, the virus follows where the mosquito goes. In fact, it was hypothesized that the Japanese occupation, when they were coming into the World War II, the tanks and the machinery were the ones that were transporting all the mosquitoes down into Southeast Asia and Singapore. So where the mosquitoes are, that's where you'll find the virus. So that virus, Aedes aegypti, not only transmits dengue, it can transmit chikungunya, it can transmit Zika virus as well. So potentially we are all at risk. Singapore is paranoid with yellow fever as well because it can actually transmit yellow fever. Now, malaria is a bit of a different ball game because it's transmitted by a different mosquito. It's actually the Anopheles. And the Anopheles, compared to the Aedes, is a night biter and day biter. So the good thing is Singapore is malaria free. They really worked hard in getting rid of malaria, and malaria is a bit easier because you have the female and the male version of the parasite, which has to mate in order for it to be possible. In the case of dengue, you just need one virus in the mosquito, and it can propagate again.
Okay. Highly transmittable, highly effective transmission. Yeah. Now, I'm a physician in Germany. I never saw a case of dengue in my hospital and in my life as a hospital physician. How do you diagnose the disease? From all I see, it's unspecific, right? There is no measles-like rash or no whatever sign that you say this is dengue. So what's the suspicion points before you can diagnose it?
Okay, number one, go to a country that's endemic for Aedes as well as dengue fever. So talk about Singapore, Southeast Asia, right up to Thailand. Now, even certain countries in the summer weather, where the mosquito population breeds up again, you may actually have them in other countries. Even Italy, Sicily is well described. If you go down to Florida and during the summer months, you can. So where you find the mosquitoes in the right time. How would I diagnose it? Fever, headache, muscle ache. That's the key symptoms. But that fever, headache, muscle ache happens in practically all other viral infections. So it's really hard to differentiate. The clue, since you're listening to Joe Smith's program, there are three clues that will help you diagnose dengue from the history alone. Number one, they tend to have very bad pain behind the eyes. One of my physician friends described it as in someone stabbing your eyes and trying to push it forwards altogether. Pain behind the eyes. They don't get the photophobia, they don't get the neck stiffness or meningitis, pain behind the eyes. Number two, they can have a lower back pain. It's in Chinese they call it a back breaking fever because the back is really awful. But be very careful. You may have actually a urinary tract infection with pyelonephritis as well. So back breaking, pain behind the eyes helps a lot. The third thing is for the very, very sharp patients, they'll tell you, I've been drinking gallons and gallons of water, but my urine is still yellow, and that's not usual. Now,
Okay.
if you have influenza, RSV, or whatever virus, you drink about 2 to 3 liters of water, your urine is clear. But for dengue, my brother drank more than 3 liters of water, and his urine was still not colorless clear. So that's because the water retains inside the body, and in terms of the pathology, it leaks outside the vessels into the surroundings. And this leads to what we call the dengue hemorrhagic fever or the dengue shock syndrome. So three symptoms again: pain behind the eyes, back pain, as well as the color is the urine color still remains concentrated despite you drinking lots of water.
Great. And so these are the clinical symptoms you're watching for. Now, you certainly want to confirm the diagnosis, right? You want to make sure this is dengue. Which tests, laboratory tests, are there?
There are three tests which you can do. Number one is the dengue NS1 antigen. Dengue NS1 antigen is best on the first 3 days of illness, especially on day 3, and thereafter it falls. So day 3, dengue NS1 antigen looks for the protein antigen. At day 5 onwards, the antibody starts appearing. So you have your dengue IgM, IgG, best on day 5 and after. And last one, you have the dengue PCR. PCRs is much easier to really get it all over the world. You can do it between day 1 to day 7. We tend not to do that because it's an expensive test with the ready availability of NS1 antigen as well as dengue serologies. So dengue NS1 antigen, day 3 onwards, day 1 to 3, we have the dengue antibodies at day 5 onwards, and the dengue PCR between day 1 to day 7.
This is great. So we have the clinical science, we have the laboratory confirmation, and what's the treatment? What do you do with the patient?
3 words: water, water, water. What you really need is water. So one of the things which I love very much is I will insert a plug and I'll run in fluids. For adults, it's at least 3 liters of fluid, continuous infusion. I give a little bit of potassium inside the drip, and the next day, the patient will say, "This is fabulous." The drip feels better than the wife consoling him, etc.
Yeah.
So drip and water is very important. Once the fluid goes in, the nausea that comes with the illnesses, the dehydration, the aches starts feeling better. So the patient can immediately start drinking something. We encourage the patient not to eat oily, fatty food just in case the reflux adds up. So the rule of the thumb is this: fever goes on for up to 7 days. Up to 7 days, the platelets will decline all the way to about day 8 and start climbing at about day 9. 7 days of fever, platelets lowers at day 8 and recovers about day 9. And it almost works like clockwork. But for those people who have had dengue previously, the platelets might plunge much faster, but those who plunge rapidly will tend to recover quickly. I'm going to talk a little bit about 2 things. One, Singapore, the region, is obsessed with papaya leaves. In fact, if you were to tell the nation that you had dengue fever, he would think we brought you the elixir of youth by giving you papaya leaf drinks. The answer is it doesn't make a difference. It's not about the papaya leaf drinks or even frog legs soup. Frog leg soup. It's not that. It's the water composition inside that makes a difference. So forget about the frog legs, forget about the papaya leaves. The third thing which we love to talk about is platelets transfusion. In dengue fever, one of the things is the platelets will plunge and plunge and plunge all the way to day 8. So years ago, when I was still a trainee, we would actually give transfusion of platelets to try to keep the numbers up. But the studies have shown that it doesn't make a difference. If I would, we ended up, Singapore and Malaysia ended up with a trial, half the population, where they allowed the physicians to give the platelets as and when they wanted to. As and when they wanted to, when it was about 20,000, give it at their own delight, to the fancy of the physician. The other group, you only gave it when there was bleeding. Of the 2 groups, the ones that did better was the one where they received platelets when there was bleeding. Why? The group that had prophylactic platelets ended up with blood transfusion reactions. In fact, this study was done in Sri Lanka. 2 of the patients died because of transfusion reactions secondary to platelets. So the best thing to do is to tie the patient down in bed. I'm not trying to be kinky, but tie the patient down in bed, and all he does is to have fluids in the drip, drinking lots of water, recover by day 9, the platelets recover, and everything will be fine. Be very, very careful. Some of them go into severe vascular leakage. That's because the cell-to-cell spaces enlarges, water leaks out. And you can understand why he feels thirsty. He drinks it, it goes into the vessels, but it leaks out. And when such individuals come out, you notice that the hands will swell up, the face will swell up, even the mucosa lining may swell up. Some people will have third spacing in the lungs, and in the bad cases, they will require high flow nasal oxygen, or previously, sometimes we even had to do mechanical intubation because we didn't have high flow nasal oxygen then. The point then is to be supportive all the way, right to about day 9. And the best jewel in the whole discussion is this. Because you're listening to Joe Smith's program, about 10% of them will end up with a acalculous cholecystitis. No stones, we call it cystitis. Hence, don't take oily, fatty, spicy food. Let your gallbladder rest. The best thing to do is to leave it alone. I've never had to remove the gallbladder for anyone. Rest, best time to lose weight, water and fruits. Eventually, after a few days, it will recover.
Excellent. Excellent. And one additional question, would you regularly use, or what would be the indication for using heparin or something similar? What do you, is that used at all, or is this not needed?
It's not needed at all. If you're wondering why the platelets fall, it's primarily a consumptive problem. The platelets get consumed.
Okay.
And just a curious fact, if you were to do the bleeding parameters, you have the PT, prothrombin time, and the partial thromboplastin time. It is one of the causes, dengue is one of the causes of elevated PTT time, partial thromboplastin time, with a normal PT. But in the severe cases, both can be elevated.
Okay. Interesting. For someone who never treated such a patient. Now, this was treatment, and I'm wondering, I know there are vaccines out there now today, and at least one is licensed, the one from Sanofi. And maybe you can tell us a little bit why not everybody in Singapore gets the vaccine right now.
No. Okay, so dengue vaccine, the currently available one is Sanofi Pasteur. I think they've been around for at least 5 to 7 years. So the 3 shots of it is based on the yellow fever vaccine. There was some bad news about it. When they tried it on the children, it didn't work very, very well. When I talked about children, I'm talking about 6 months to 8 years old. They didn't do very well. In fact, they had worse cases. And when they look back at it, the numbers appear to be bad because those are individuals who have never had dengue before. If you have never had dengue and you get the vaccine, you may end up with a worse outcome. But on the other hand, if you had dengue previously and thereafter you had the dengue vaccine, the efficacy was beautiful. The studies show that efficacy of at least 90 to 100%. So it works very much as a booster vaccine. Or nowadays, because of COVID, we call this a hybrid immunity, where you had the infection previously followed by the vaccination. That works well. But because of the warning in the younger children, is approved for many countries 9 years old and above. Singapore took a higher cut of about 12 years old and above. Okay. Now, you know about the yellow fever vaccine. When you're about 60 or 65 years old, you have the rare visceral tropic illness, disease and complication. So we took the upper limit in Singapore to be 45, but many countries were happy to take it as 65. Different countries, slight variation, but that's where the problem comes in. You need the vaccine for those elderly who were to get dengue. But if you can't give it to them at 65 and above, then you're not giving the population that needs it most.
Yeah.
So this was one of the Achilles heel of Dengvaxia from Sanofi, and they couldn't give it to the very young, so they were really very prone. So all the competitors came in, including one that's asking for licensing now by Takeda. Takeda is suitable for children, is suitable for adults as well, but some countries have approved it. Some countries have approved. In Singapore, it's still going through the due diligence. We do not have approval for Takeda in Singapore yet.
We will come back on this one in a later special on dengue vaccines. Maybe one last question, Honam, and this is, what is the effect of climate change on dengue virus and dengue fever? Any thoughts?
It's a sigh because the footprint enlarges. As the temperature warms up, we have more and more countries that provide suitable breeding grounds for the mosquito. Florida, southern parts of Italy, when the warm weather permits, the mosquito can thrive again. So as long as the mosquito can thrive, you will have the virus going there. I'm going to let you off and remind you of two very crucial factors about the mosquito. Number one, when you lay the eggs, and one of the places they love to lay the eggs on is on the container walls. On the container walls, it'll be stuck on the container walls. You can sun them, dry them under the hot, sunny weather Singapore, but the eggs don't die. What you do is you add some water to it. Remember, 1 pound coin of water, add it to the eggs. A few days later, you start seeing some activity because the eggs will start hatching. Number two, the virus can be transmitted vertically from the mother mosquito to the baby, though we believe it's not the major means of transmission. So the baby, in turn, the baby mosquito that comes out becomes laden with the virus at the word go, at the word is born. If you really want to get out the eggs of the mosquito, my dear friend, you have to use a lot of elbow grease. It means scrubbing the walls real hard on something you can't see, you can't detect. So in other words, Singapore, Southeast Asia, will never be rid of this Aedes mosquito. The best thing to do is still to get out the breed and perhaps a successful Wolbachia mosquito introduction.
Yeah, I understand this now. And I guess my question was hitting a little bit towards Germany. I think there are cases here in Northern Europe now, even. I guess we have to follow this very closely in the near future, and we may need your learnings from treating and diagnosing and treating dengue, so to make sure that people know about it when more of these cases arrive. Any last words from your side? Something I missed in my question? Any last thought that is important to you?
I think we really covered a lot of grounds. The unfortunate thing is, as the world expands and the world is so connected now. At one moment, see, Joe could be in Germany, and the next moment he's in Singapore. He could bring dengue back, and in the right and opportune time, you could actually have a dengue outbreak again. So the world is getting smaller. Whatever diseases is happening in Singapore could happen right at the doorsteps in Germany, or whatever is happening in Germany, including the dreaded limes, could come into Singapore. Well, the world is becoming cozier and smaller.
Yeah.
Thank you very much, Joe. As usual, you are fabulous.
Thank you very much, Honam. It was a great pleasure and honor to have us today, and I really love the way you presented. This was our Global Healthcast special today on June 9, 2023 on dengue with our special guest, Professor Honam Leong from Mount Elizabeth Hospital in Singapore. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt, and I wish you a wonderful rest of the week. Bye-bye.
Bye-bye.